Welcome to part one of the special orthodontics interview series for general practitioners and pedodontists. I'm your host, Paul Spazielli, and today I have as my guest Dr. Rob Bond. Dr. Bond has been practicing for over 40 years in Flesherton, Ontario, and over 30 with orthodontics in his practice. He is a co-founder of the CSW Orthodontics course, now in its 34th year, and also the co-founder of the IAC Practice Management course. Welcome, Dr. Bond.
Thanks, Paul. It's great to be here.
Great. Now, before we go over the 5 critical things that GPs and pedodontists need to know before selecting an ortho course, but why would someone even add ortho to their practice? I mean, what are the top benefits?
Well, Paul, there's probably more than I'm going to elicit right now, but the top one that comes to mind is, for me at least, the joy of getting and giving. It's so rewarding to take these young growing faces and turn them into what could be a challenging malocclusion to fix if it's left till it's later to develop. So functional aesthetic smiles and healthy jaws are the main outcome of orthodontics that really excites me. One of the next reasons, of course, is it's all about money, isn't it? But I mean, for sure, your office production will see a big boost when you do orthodontics. Why would you want to send that out? Even if you're just doing the simpler cases, it's still a real advantage to be able to do ortho in your own practice. And then next, you may be bored with the just drill and fill effort that you go through every day. Certainly orthodontics is a new and exciting challenge that you can revitalize your life and your practice. We've had several older dentists that have taken this in their later years, and they just are thrilled to be able to accomplish what they can with orthodontics in their practice now. Yeah, and lastly, it's certainly an easy sell. I think orthodontics is the third biggest ticket item that people undertake, second only to a mortgage and a car. After doing orthodontics for 32 years in my general practice, I decided that in 2000 I would start my own practice strictly doing orthodontics and TMD out of my lakefront home, and I've been doing just that for the last 8 years. And it's gosh, I don't know how I did the general dentistry for so long. It really is much more relaxing to do orthodontics and TMD than it is to do general dentistry all day long. And lastly, one of the most important things is that you transform yourself and your practice, certainly with the new knowledge that's acquired, that it's not just in orthodontics alone, but also will help you in your crown and bridge and other aspects of your general practice. And orthodontics certainly is an investment in yourself when you add orthodontics to your practice and invest in the knowledge and having the ability to do this type of work in a general practice. It certainly makes a big difference, not only in the bottom line, but in the way you feel about yourself in general.
Okay, great. It seems like you've built a great case for integrating ortho into the practice. It seems like every clinic should have ortho. It just makes sense. Now, for GPs and pedodontists that are thinking of an ortho course, certainly there's many courses out there, and there's a lot of different criteria. But maybe you can help them out. What are some of the top critical things they should consider? You don't want people to sign up for a course and then discover something they should have considered before. So, can you elaborate on some of the top critical things they should be looking for in an ortho course, please?
Certainly, Paul. I'll be happy to. There are about 5 critical things that GPs and pedodontists need to know before they register for any course. So you want to know these things before you get involved, so you don't have to make some costly mistakes when you get involved in a course you're not really comfortable in. You should make sure that the course you're taking is a complete course that will allow you to start and finish any case, that it employs the latest in technology, allow you to do, for example, Invisalign, and understand what tooth movements are all about. Make sure the courses are not cookbook courses. Why? Because some cookbook courses don't give you enough information, unfortunately, so you can finish your cases. And that's a big bugbear for the orthodontic community as far as GPs doing orthodontics goes. Simplified and unique should be another criteria. And what kind of differential diagnosis are they teaching in the course that you may be considering? Certainly there should be an unbiased view that orthodontic vendors and techniques should not enter into how you choose appliances. It should be evidence-based information. Reject any course that may offer you methods and supplies and not allow you to do their type of orthodontics unless you use their products. Certainly that's one thing you should avoid. And check out the instructors too, and make sure that there's lots of case studies that are in the teaching part of the course. We have 25 years of study clubs where we spoon feed people and help them through every step of the way with individualized treatment and personal case studies in every session. Another important point to consider is to get recommendations from students that have taken the course that you are anticipating. Make sure that you get some references from past graduates and check them out. And lastly, and one of the most important things, certainly in today's environment, is to make sure that the CE credits that you collect from any course are comprehensive and that they will offer those to you for your mandatory continuing education point credits. And see if there is, lastly, a guarantee so that you can, if you decide to take a course, to opt out of it if you don't think it's for you after you've had the opportunity to listen to a little bit of it. I think that's an important thing that I look for as well. I hate wasting time at courses when I get nothing out of them.
Okay, great. That's a great selection of criteria that both general practitioners and pedodontists should be looking for before selecting an ortho course to avoid wasting their time. Now, you co-founded the Comprehensive Straight Wire course. Is an ortho course that's been going on for 34 years. I just wanted to know, just curious, what's the basis of it? How did it come to be, and essentially what makes it unique and sort of different than all the other ones?
Sure, Paul. I'd be happy to talk a little bit about that. Certainly, I've always had a passion for orthodontics, even when I was in school. And when I graduated, that passion continued on into my general practice. I started off doing removable orthodontics back in the 70s and got very serious about doing orthodontics in the 80s when I found that removable appliances couldn't do everything that the good labs told me they would do. Al and I both were taking separate ortho courses, and we would run into each other at these courses at different venues throughout North America. And we kept seeing each other even though we were in the same class. We never really knew each other other than by name. We got together and decided that we should find and develop a course for general practitioners and pedodontists so that they wouldn't have to do the same things that we were doing. Back in the 70s and 80s, it was very difficult to get an orthodontic education because the orthodontists didn't want to seem to share their knowledge very much. So we traveled widely throughout North America and Europe. For myself, I acquired a lot of schooling from Dr. Rudolf Slavichuk out of Vienna, and I spent hundreds of hours learning how to do TMD and learned a new and keen appreciation for orthognathics and occlusion, which led me into certainly doing better orthodontics when I knew what to look for. It's not just a matter of making teeth statically look good, but they have to function as well. So we decided that we would pool our resources and certainly see if we could come up with something that clearly was not offered back in those early days to general practitioners, a very comprehensive 10-session program that would allow them to acquire the same knowledge that we had taken hundreds and thousands of hours to acquire and pool our resources together. So you have now about 80 years of certainly acquired knowledge from many, many different venues and resources. So we think we've got a pretty comprehensive course, and we're quite proud of what we do. We started off in rural communities, which was another necessity because orthodontics certainly wasn't available to those people. They had to travel, at least in my situation, and I think Al's too, at least an hour and a half to the nearest specialist. So it was a necessity that we learn how to do some of these skills, and a hunger for and an appetite for knowledge was certainly the thing that was our driving force, and we kept adding and evolving as time went on, as does our course. Even to this day, the course is never given the same as it was the year before because of new knowledge and information that we've added. So that's a brief overview, Paul, of how the CSW Comprehensive Straight Wire course was started and how it's still evolving today.
Okay, great. Thank you very much for elaborating on the course history and some of the reasons why you developed the course. For the upcoming course, you have it broken down into 10 sessions. Now, what parts do you teach? Which sessions do you teach? And what are some of the things that you're going to be teaching in those sessions? In other words, what should general practitioners and pedodontists actually expect to be getting out of that?
Well, that's a great question, Paul, and certainly I would want to know that if I was taking this comprehensive a course. So I'm going to try and skim through these fairly quickly because it's impossible to give you every single detail. But my charge is to do sessions 4 through 8. Al does the introductory. We assume that no one knows anything about orthodontics when they start the course. They don't know how to trace a ceph. They don't know what the cephalometric measurement's all about. They don't know how to put a bracket on. So we start the course assuming they have no knowledge at all and carry them right through. After they've got an introduction in the first 3 sessions, I start with the doctors in session 4, and session 4 and 5 basically are about early treatment and learning to use growth and development to your advantage through interceptive functional orthodontic therapy. The first day of session 4 is all about growth and development after Don Enlow. We talk about posture, we talk about early treatment, we talk about a very unique appliance that's not taught in any other course, the Cusick Bone Remodeler, which is, in my opinion, probably the best functional appliance on the market today. We talk a little bit about pre-functional appliance therapy, rapid maxillary expansion, corn lip bumpers, clasp design, sagittal appliances, Schwartz appliances, Jackson's, Crozads. Then we get into the extraction controversy about which teeth, if we're going to remove teeth, should be removed, 7s, 8s, 4s, 5s. We also talk about serial extraction, which is a viable alternative in certain jaw discrepancies. And then we talk about the transition of the human dentition. That's all day 1 of session 4. Day 2 of session 4 is about taking a bite registration. We uniquely mount all our cases on a SAM articulator or any other articulator you're comfortable with so that we get a good representation of where the jaw relationship actually is when the joints are seated in the socket. Then there's a brief history about how functional appliance therapy started with the activators, bionators, twin block, and certainly my favorite appliance today, the MAR appliance, which is simple for non-compliant patients. So that's session 4. Session 5, which is the end of the first year, is all about functional appliance therapy, treatment planning, air rotor slenderizing, and then there's a wire bending exercise at the end of that session. Some of the highlights of session 5 are Frankels and Faces, where we talk about impression techniques, lip seal exercise, the importance of lab communication and patient management. I speak about face mask therapy after Henri Petit, the different types of face masks that are available and when and how to use them. We talk about the Herbst appliance and when it should be used and the current research behind the Herbst appliance, the Twin Force Bite Corrector, which is an offshoot of Herbst appliance, as is the Hank's Herbst. appliance. Then we get in a little more depth about the MARA appliance, for example, clinical management of the MARA and sequencing of treatment, how, when, and why to select these cases. All of these are backed up with clinical examples and numerous case studies. One of the other appliances we talk about is the Bite Director, which is a unique appliance as well for treating maxillary excesses. The next part of Session 5 has to do with treatment planning, sequencing of treatment objectives, the 3 phases of treatment, and which wires to use and when. Very important topic. It's the start of differential diagnosis for the doctors. And then a very unique method of treating crowding without taking teeth out was championed by Jack Sheridan when he talked about air rotor slenderizing. We talk about the theory and the research behind that, and that's backed up with, again, countless case studies of cases that we've completed. And lastly, to close out that session, we do a wire bending exercise so that you can bend your own O2O arch forms, talk about extraction arches and coordinating arch forms, and when and how to expand arches, and the Darrell and Darrell stopped arch, again unique to Canadian straight wire, the pliers that are used to bend these wires, and sectional arch wires. That pretty well wraps up day 2 of Session 5. Session 6 has to do with common sense mechanics after Tom Mulligan, which Dr. Macdonald briefly goes over in the first 3 sessions, and I take that information that he has given the doctors in the first 3 sessions and expand on it over the next 3 sessions, Sessions 6, 7, and 8. We talk about treatment planning again, the problem with solution list, and the start of our Canadian straight wire charting system. We talk about the golden divider, which is useful not only in orthodontics but in cosmetic dentistry. The afternoon of day 1 has to do with airway concerns. One of the biggest topics, I think, in orthodontics today, and comprehensive literature that you will read, airway concerns at an early age are certainly something that needs to be considered. And we'll talk to you about how to look for those airway concerns and what to do about them, and how to refer to ear, nose, and throat specialists. Day 2 of Session 6 has to do with the administration in orthodontics, where we talk about the finances, the fees, the charting system, the records appointment, and the consultation appointment. And we also talk a little bit about the general business of dentistry itself, which is an offshoot of the IAC course. And then in the afternoon of day 2 of Session 6, we talk about airway, the treatment and recognition of long face syndrome, using magnets in the form of active vertical correctors to treat these cases. And we also developed a vertical checklist, again unique to the Canadian straight wire system. And then lastly, we go over McNamara's diagnostic system, again stressing diagnosis as being one of the most important things that we do with the doctors, showing them how to diagnose properly, and they do cephalometric exercises at the end of that Session 6. Session 7 is the next session that I teach, second to last, and you'll learn how, when, and why you should treat TMD patients. We'll talk about Owen's diagnostic system, again promoting diagnosis as being the key thing behind doing orthodontics. And then the second last part of common sense mechanics after Tom Mulligan. During the TMD overview, we will talk about centric relation and leaf gauging and anterior deprogramming and mounting models with face bows, and actually do demonstrations on how those things are done. We talk about the occlusal principles. We'll talk about bruxism and how to collect and select the most appropriate vertical dimension for patients. We'll talk about TMD anatomy, what's normal, what's abnormal, myofunctional pain, radiography, and the examination of the joints using MRIs, Dopplers, and so on. Talk about intercapsular problems, and then we have a flow chart for the progression of treatment. And then in the afternoon of that same day, we'll talk about how to choose the correct orthotic. This is certainly one of the things that most doctors are so confused about, and why not. There are at least 5 different types of appliances, and we'll try and clear that up so that they understand which appliances, which orthotic, which piece of plastic should be used, and how it's used. In the afternoon of that session, we'll talk about Owen's diagnostic system, a culmination of many diagnostic systems with visual treatment objectives, and we'll do lab exercises and case presentations on Owen's diagnosis, again promoting diagnosis of their cases. And then the last part of that session, we'll talk about common sense mechanics, part 2 of Mulligan mechanics, which we will review part 1, and subsequently talk about extraction mechanics by cuspid extraction, retraction of cuspid, molar protraction, the wires and the pliers that are used. We'll talk about pure intrusion and how it's done very simply and easily with a tweed loop plier and a couple of bends on the wire. And we'll talk about the cantilevered overlay. So that pretty well wraps up Session 7. Session 8 is all about retention and molar distalization and cosmetic appliances. We'll talk about the myths and truths about retention. Certainly one of the most important things we feel that general practitioners should be using is a positioner, a nathological positioner from a mounted set of models on an articulator that is Facebook generated. We'll talk about the occlusal guide, different kinds of removable retainers, both fixed and acrylic. We'll talk about Essex retainers, and this is where we get into the subject of moving teeth around by using Hilliard pliers, and we'll have a very comprehensive overview of how that's done with Essex retainers that I've been using for many, many years now. In the next part of Session 8, we'll talk about the multidistalizing arch, which is something I still use today after Dr. Wilson. Wilson mechanics in general, distalizing teeth using magnets, the Jones jig, the pendulum appliance, and then an overview of all the comprehensive ways to distalize molars, which seems to be one of the mainstays in orthodontics today and one of the most misunderstood ways of accomplishing molar distalization. Lastly, we'll talk about speed and cosmetic appliances, the passive self-ligating bracket, and why it's important to understand how those systems work. Talk about Ponce Index, and then lastly, Mulligan Mechanics, the last in the 3-part series, which will address open bite correction, molar control, cuspid control, cross-bite correction, and diastema closure. So that pretty much wraps up, Paul, what I do in the 5 sessions that I teach. And then Session 9 and 10 are handled by Dr. Macdonald when he comes in and continues on, and I'll let him tell you about those 2 sessions that he teaches.
Okay, great. Thank you very much for breaking down the sessions that you teach. It sounds like it's quite comprehensive. You weren't kidding when you said that. Now, for our listeners that want to register for the course, how could they do that?
Well, all they have to do, Paul, is to go to www.cswfop.com. That's Canadian Straight Wire Functional and Orthopedic Program.com. So www.cswfop.com, and just click on the registration button, and it should be pretty comprehensive. When they do that, they should be able to have no problem registering for the course, and we'd certainly like to see some doctors take this course, as we've worked very hard to develop it, and we think it's probably one of the best courses available today.
Great. Thank you very much, Dr. Bond. It was a pleasure speaking with you.
Well, thank you, Paul. Likewise.
So today we covered the 6 reasons to add ortho to your practice, the 5 critical things you need to know before registering for an ortho course, what the CSW course is, and what you'll get out of it. So join us for the second half of this special interview series for the CSW course, where we have Dr. Alan Macdonald, the other co-founder, on the top 3 questions GPs and pedodontists ask about ortho, the top 3 questions they don't ask but they should, and also how to choose an ortho course right for you with this handy guide.